Hip dysplasia treatment options.
So in terms of treatment options, there's no clear-cut easy answer to treatment options. It does vary from state to territory across Australia, and it varies from specialist to specialist. Sometimes it can be just preference of the specialist as to why they've chosen a particular treatment option. It can be to do with the best fit of the harness or brace on a child, and it can be to do with the size of the child as well. So there are quite a few differences in Australia. The most common ones that you'll find, this one here on my beautiful little demo doll, is a Pavlik harness. So this is most common across Australia for children from birth through to around 4 to 6 months of age. Now, the other one that is quite common as well in that age bracket that can be extended up for longer wearing, so babies up older than 6 months, is what's called the Dennis Brown bar, or for short, the DB bar. These now are being made using like 3D printers, so some of them are looking a little bit more funky now than the old-fashioned bar, but still with the cuffs on the end. Slightly more rigid, doesn't allow for the legs to kick around, but very common in New South Wales and in Victoria. Now, over here in Western Australia, where I'm based, in conjunction with the Pavlik harness, there is the Correctio harness. So WA is the only state still using the Correctio. So this is where this bar here sits underneath the legs. The bar will then stick out at the front. So this is one that can be a little bit problematic for wearing a baby in a baby carrier. And these straps go over the shoulder, and this sits on the baby's chest here. Then if you're moving up towards the warmer climates, so up through the top end of Queensland and through the Northern Territory, sorry as I reach down to get stuff, you've got this one which is called the Von Rosen. So the Von Rosen is a thermoplastic splint. Again, it's holding the legs out in the frog-like position, comes up over the shoulders and around the waist. A lot of families see the Von Rosen and they think, oh, it's so barbaric. They wonder why their child has it and not many others. Like I said, it's typically mostly only found now in the Northern Territory and up in the top end of Queensland. A good point to let parents know about is that it's waterproof, so you're able to wash your baby in this splint, and that's often why it's used up in these warmer climates, because it is harder, they feel, to have a baby not go unbathed for the treatment period time. So that's the Von Rosen. Now, one of the other adduction braces used as a baby gets older, so again, typically from 6 months upwards, is what's called the Rhino Brace. So it's another form of an abduction brace. So this is the Rhino Brace on my other demo doll. And again, it has a thermoplastic base, a foam with Velcro cuffs. Baby's bottom does need to sit down into the brace so that the legs are out in an abduction. And that's the back of the brace. So they're the most common types of braces and harnesses used in Australia. If a child is unable to be treated successfully in a harness or a brace, and usually they will do an attempt of fitting one in the first instance with a baby, then there is the need to look to do either a closed reduction, where the ball and socket of the hip is positioned into place while the child's under a general anaesthetic, and a spica cast is applied, or sometimes they need to go straight to open surgery or an open reduction, and again, spica cast. Some children will have a spica cast that will go from chest down to toes bilaterally on both sides. Occasionally it might be only to knee, or it might be different lengths on each side depending on whether or not one or both hips are impacted. And also there is the use of the broomstick, which is the reinforced bar across the lower legs to provide increased strength as well. So they're the most common treatment types.